team and kids all throughout the county who have been using the Montgomery Ice Rink, Cabin John, Wheaton Ice Rink, I'm sorry, the Rockville Ice Arena, Cabin John and Wheaton, as a way to see their friends, as a way to get energy out, as a way for physical exercise. Just the difference that you see emotionally and mentally when they are together, as opposed to when they've just been stuck at home since essentially the middle of March. The difference in their attitude and the way they behave is remarkable. The Montgomery Youth Hockey Association has taken extraordinary steps throughout the entire pandemic to keep people safe. There's been no known community transmission at all regarding within the club. And to limit it to 10 is really going to set our kids back emotionally. It's not right. The kids have really struggled, and the kids have really, really been hurt by being stuck at home with no school. The only way they communicate is through video games, personally, and that's absolutely no way to do this. So I'm asking to please grant us a waiver, to please give us the opportunity to continue to play hockey games. If it means no parents or no spectators allowed, so be it. But we have done a great job within the club, or the club is in the protocol that we've already instituted all summer, all fall, to keep. Okay, thank you very much. And okay, thank you.
Okay, thank you very much. Our next speaker is Chris Mowell.
I'm actually speaking on the restaurant and dining experiences. Just would like to let you guys know that I have a few of my friends that is waiters at small businesses that don't allow outdoor dining. And one of my friends, unemployment is going to be ending December 26th. And she's only getting $56 right now. And that's not going to help her rent the next couple months. So please encourage the rest of the county council and you guys to keep the dining open, as we all should deserve Christmas as well. Thank you.
Okay, thank you very much, Mr. Mowell. And we'll pass to our next speaker is Joe Bowers.
Good afternoon. My name is Joe Bowers. I was born and raised in Montgomery County. I'm not a business owner, and I'm not a store manager. I'm just a concerned citizen and concerned about the things that are happening in this county that I've lived in my entire life. I feel it's way past the time that we start taking the steps to protect the vulnerable and stop these draconian measures. Our county executive and health officer constantly refer to the science and the data behind these decisions. We'd like to see the data that proves indoor dining and gyms are such a problem. You're putting thousands of people out of work 2 weeks before Christmas. With regards to testing, what is the PCR cycle threshold for county tests? These tests are proven to be unreliable and produce many false positives. Why aren't we following the CDC guidelines for testing? To quote the CDC website, not everyone needs to be tested. Only those with symptoms or people in close contact with a confirmed positive test, unquote. The county social media is still telling everyone to get tested. Why? Between testing, the mask mandate that the county erroneously refers to as a law, and the snitch line, the county has turned into an intolerable nanny state. It's unacceptable for our county executive, health officer, and county council to force hardworking business owners out of business while never missing a paycheck. I'm proposing the county executive, health officer, and council members all donate their salaries to employees of restaurants and gyms and other businesses until all of these unconstitutional mandates are permanently rescinded. After all, aren't we all in this together? The cure is now far worse than the disease, and it needs to be solved. Thank you.
Thank you very much. Our next speaker is Wendy Hookman.
Hello. Thank you for the opportunity to address, to address the council today. I am Wendy Hookman, a physician and founding psychiatrist at Washington Center for Women's and Children's Wellness, a mental health practice in Bethesda. I'm also the mother of 3 teenagers, all of whom have been learning virtually since the beginning of the pandemic. 2 of my children are hockey players, so I consider myself close to an authority on mental health and its relationship to hockey. Today, I'm here to speak on behalf of the Montgomery County youth hockey community. It is my understanding there is a letter of approval request from the Montgomery Youth Hockey Association under consideration by the executive that would address the risk factors which that organization and the county have identified with hockey games so far, and that should continue to keep hockey games open and safe, which I and my family have found it to be, even in these really difficult times. If we cannot amend the order, I urge the executive to adopt MYHA's proposals. COVID-19 is a terrible disease, and it of course can be transmitted to any person. I'm here to explain why the benefits of hockey, when evidence-based precautions are taken, as they have in our county, outweigh the risks to children and their families. My practice is seeing the consequences of the pandemic: weight gain, motivation loss, insomnia, widely reported school failure, depression, anxiety, and suicidality. We as Montgomery County will be dealing with these for years to come. Team sports in particular lead to improved mental health because of their social nature and support. Even in the face of this nasty COVID surge, which is very real, this is not the time to be short-sighted. Hockey has been the only outlet for hundreds of Montgomery County children in winter, mine included. They're at home, staring at their computers all day, every day, and weekends aren't all that different. Going to their hockey practices and games is the only normalcy in their lives.
Your time is up. Okay, we're gonna move to our next speaker. Thank you very much, Mrs. Hookman. And our next speaker is Christopher Sargent. Mr. Sargent?
Yes, good afternoon. Can you hear me okay?
Yes, we can.
Okay, great. Good afternoon, Council President Hucker and council members. Wegmans Food Markets has operated a 124,000 square foot store in Germantown since 2013. As an essential business, we have been fully operational through the COVID-19 pandemic, making many changes to our store and our protocols to ensure the safety of our customers and our 394 employees. Since November 10th, we have limited our occupancy to 25% of the legal maximum. The proposed Executive Order 139-20 states occupancy must be limited to 1 person per 200 square feet, but not to exceed 150 people, regardless of the size of the store. The arbitrary cap of 150 people reduces our allowable capacity to 5.5%. Reducing our occupancy by 95% will create long lines outdoors in cold weather during the holiday season and will likely lead to panic buying. Montgomery County residents will leave the county to shop in the neighboring counties, which have 25% occupancy limits and stores with no lines. This will not help with the intended goal of reducing community spread. Wegmans asked the council to reject the executive order and asked County Executive Elric to keep the cap at 25% occupancy for food essential businesses, or in the alternative, 1 customer per 200 square feet. The current 25% occupancy restriction is in line with the new restrictions in Anne Arundel and Prince George's counties and more restrictive than the statewide 50% occupancy limit. We monitor our crowd flow very closely and have never exceeded 510 people, which is less than 20% of our occupancy. We feel that either 25% occupancy or 1 customer per 200 square feet is a perfectly safe level to manage the flow of customers and ensure social distancing. Thank you for your time.
Thank you. Our next speaker is Kaylee Lucklier.
Good afternoon, honorable members of the Montgomery County Council. My name is Kaylee Locklear, and I'm here on behalf of the Maryland Retailers Association. We'd like to thank the county executive, Councilman Friedson, and the council for your work on addressing the 150-person cap issue that you've heard a couple of times already today with the new executive order. The largest retailers can easily have 50 to 150 people working in store this time of year, which would immediately meet that threshold. And in the only other state or jurisdiction with a similar cap, we ended up seeing huge lines outside clustering around registers despite our floor signage, and associates who could otherwise be helping people get in and out quickly to prevent spread then being used to monitor occupancy. So this is all coupled with the fact that research has shown transmission predominantly occurs in a few common locations. But I want to be very clear that retail has never been pointed to as a top location for transmission. We consistently advocate for a level playing field between our different size members, and this would have blatantly put larger stores at a significant disadvantage. As to not disrupt operations, we would respectfully ask for clarity regarding the turnaround time for letter approval. Our understanding is it must be submitted by 5 p.m., but I think you're going to go ahead and hear from almost all of our members and larger retailers today. If we could just understand when that approval will be granted, that would be great. We understand what's at stake here and the need for measures to stop the spread. We take, as an industry, our role very seriously and have implemented aggressive policies and procedures to keep consumers safe. So we thank you for your understanding and in working with our industry. If we can get clarity, that'd be great. Thank you.
Thank you very much. We want to call one more time Matthew Milka. He seems to be connected. Matthew Milka.
Yes, Matthew Milky. Hi, thank you for giving me the opportunity to speak. I just wanted to speak on behalf as a citizen, not a business owner or anything, but I'm hoping that this order to reduce the size indoor dining could be rejected by the county council, sent back to the county executive to add some different language to it, specifically with an end date to it, a 3-week policy similar to that is being done in other jurisdictions. We are currently not in a position to put people out of work nationally. We don't have any COVID relief package, and honestly, in this current political climate, we don't know if it will happen. We don't know if it will be done by Thursday or Friday. We do not know if it will be done by Wednesday. We don't know if it will be done by January. So an arbitrary non-end date needs to be put in, removed and put in place. Also, as been stated earlier, there's not a lot of data being shared on where the community spread is being taking place. Transmission is widespread. Someone could go to church in the morning, gym in the midday, visit family in the afternoon, and then sit down for a restaurant evening and night. And it seems like contact tracing is putting all the burden on the restaurant businesses for indoor dining and other things. I'm glad to say that I live in Bethesda area and been throughout Montgomery County, and you can see mask wearing is being done, and it is being completed. So most of the transmission is likely coming from the community, recent holidays, people gathering, and more emphasis needs to be put on that and not the burden on the restaurant industry and other industries that are going above and beyond to meet the current restrictions. I hope we can leave things in place. Amendments can be made. And also, I believe that more data needs to be done on public comment. The county executive has already sent out emails saying that this is essentially going to be approved and happen this afternoon. And it seems like our public needs to have more say. Thank you.
Okay, thank you. We would like to call Chantal Preninger. Chantal Preninger. And we'll move to our last speaker, Karen Moon. Karen Moon. Okay, Mr. President, that wraps up our speakers for this public hearing.
Thank you so much, Ms. Mass. Let me call on Dr. Gales, who I believe has joined us, to make any comments and respond to any of the questions that came up. And Dr. Stoddard, welcome to you as well.
Good afternoon, Council President Hucker and Council. Always a pleasure to be with you all, and thank you for the opportunity to share in terms of insights. Let me first say, I want to be very clear. Those of us in the public health spectrum certainly respect and sympathize and empathize with the economic plight that businesses are facing. I stand with you in terms of being frustrated at the lack of economic relief package being passed at a federal level, being able to provide additional support to businesses. But our job and task is also to provide health guidance, looking at the numbers and looking at the fact that we do have record levels of cases, higher than we saw at the beginning stages of the pandemic. And we also are seeing increased hospital utilization. And so our task is to provide guidance that is based upon science and is based upon evidence, including the CDC recommendations for a host of activities, whether it's testing, metrics to go back to school across the board, in terms of putting forward policies to keep our residents safe. There are a couple of things that I would like to clarify from the information that was reported. The first one is that the information that we received from Johns Hopkins University, who provides a weekly report to health officers across the state, including the governor's office, in terms of hospital projections. Their projections have shown that closure of restaurants and bars would potentially lead to a 20 to 30% reduction in
Dr. Beals.
I'm sorry, I don't know where that came from. So at any rate, that it would cause 20 to 30% reduction in hospital utilization, which is critical in terms of our efforts to fight COVID and a host of other diseases. The second point I'd like to make is related to the perception of fairness and bias or unfairly targeting one particular industry. The restrictions that we put into place have been across the board and not focused on any one particular activity, with the exception of when we have had data provided to us, whether it's contact tracing or mathematical modeling that is influenced by all those different particular risk factors. We have taken those actions. And what's interesting is actually specifically relates to restaurants. We have actually received a lot of feedback from other industries to say that all of the policies to date have unfairly actually benefited restaurants versus other activities. So I just want to dispel the myth, at least from a health perspective, we are looking across the board and not focusing on any particular industry unless there is particular data that recommends further restrictions there. Now, we, as the third point, as it relates to sporting activity, again, we recognize the value of activities that contribute to the mental health and well-being of individuals. We also are looking at data that shows us the potential of outbreaks in those particular cases. Hockey, we have investigated a couple of situations where there have been cases transmitted amongst hockey participants, soccer, basketball, baseball, football, cheerleading, so on and so forth. And we took the step to limit those particular risk factors. Other jurisdictions have actually banned youth sports entirely, including DC, Anne Arundel, Hartford County. We took an approach similar to Baltimore County in putting on restrictions. So while there are games that may not be able to happen, there remains the opportunity to do drills and other things in smaller capacity. The fourth thing I'd like to bring up also, and I will stop there and happy to answer any focus questions, is the comments related to the larger retail stores. Let me be very candid. I went shopping this weekend. I was at least one of the stores that was mentioned in terms of representatives. We do recognize there will be further conversation around a waiver process in terms of clarifying that language. But my concern was, and I have the pictures to prove it or document it, is that there was no recognition of the 25% capacity. There was no one counting at the front of the door in terms of going in. And the checkout line, there was very little physical distancing to the point where I had to actually request people standing around me to step back because they were too close. And so it's important to understand that, yes, we can put in policies and put them on paper, but it's incumbent upon us to actually enforce them. And that is the concern as we move forward. We certainly recognize no one's trying to put anyone out of business, but we do have to adhere to policies and practices that are keeping our representatives safe. So I will stop there, but happy to answer any questions. And I know that there are a couple of other ones that Dr. Stoddard may be better positioned to answer. Thank you.
I just like to one clarification. I think it was Mr. Fahey asked about the include attachments to the letter of approval process. The portal does allow you to provide actually unlimited attachments. And so if you just have to select a couple of the drop-down menus that get you into the right category, but then you could start adding in as many as you need to. And if you have any questions about that, you can certainly reach out to covid.plans@montgomerycountymd.gov. We'll get you some additional clarification. But I just checked myself on the portal just to verify that what I was about to say was correct. And you can start to attach unlimited files to whatever LOA you send in. So,
that's great. Thank you.
Thanks to both of you. Councilmember Navarro.
Thank you, Mr. President. I want to thank Dr. Gales and Dr. Stoddard also for being here to clarify some of these issues. And my particular question, which Dr. Gales alluded to, was the issue of the hospital utilization rate. That is definitely a real concern. And as much as this is very difficult to do, I do believe that we basically have a couple of choices. You know, we could just ignore the data and ignore the fact that we are breaking records in terms of the number of cases and really tracking this issue of hospital utilization, which will then further, I think, exacerbate the economic impact. Or we take measures now that would help us mitigate the widespread numbers of cases and also this economic hit now, especially since we are seeing the light at the end of the tunnel with regards to a vaccine. So I don't necessarily, I have to say, I do not enjoy having to make these decisions. I am very aware that we as a body will have to take into consideration particular assistance, particular initiatives, special appropriations to see how we continue to support our residents. But this notion of the hospital utilization, which if I am not mistaken, we had not really seen this level before. It's a real concern, and it should be a real concern to all of us. So I do appreciate the fact that there has been some modification and some amendments, and that you will continue to work with everyone. But unfortunately, I think this is exactly what we have to do in order to address these numbers, in order to address this trend, in order to keep our community safe, and at the same time, in order to allow us to come back into some normalcy vis-a-vis our economic activity sooner than later. So I thank you. And Dr. Gales, I know you said that this particular decision regarding restaurants would get us possibly to a reduction of 20 to 30% of hospital utilization. Can you just, again, just for the record, talk a little bit about where the numbers are with regards to hospital utilization and some of the projections if we didn't do anything whatsoever?
Sure. Thank you, Councilmember Navarro. So the models that have been out, we get a weekly report based upon the number of cases, where they are, the types of hospital utilization, in terms of acute beds, our folks in the ICU, as well as the number of folks who are showing up to the emergency room or to private practice providers to seek COVID-related care or types of illnesses. And also keep in mind, we're not only looking at hospital utilization solely from a COVID lens, we know that hospitals are open for business for other things. And so if hospitals are full with COVID patients, that prevents the opportunity to take care of other issues. If it's full of flu patients, it prevents the opportunity to take care of COVID and other things. And so all of the models that we receive, particularly this group that we get from Johns Hopkins, factors in all of those different scenarios, and they play out and they roll out models based upon the level of restrictions that are in place, the type of movement, the adherence, the estimates of adherence to physical distancing and mask wearing, those kinds of things. And they paint out different scenarios. The scenarios starting about a month ago, as we continue to move forward in the absence of further restrictions, show that there is no optimistic scenario. So they have an optimistic, a less optimistic, a more concerning, and then a worst case scenario that they paint out. And given the increase in numbers and the level of restrictions they had, the models show that in the absence of further action, we would not have any optimistic scenarios related to any of the hospital cases. We would break the system. And as they move forward and refine even further with contact tracing data and with more input from a surveillance perspective, they were able to recommend and show that one of the leading activities of concern was the opening of restaurants and bars, particularly for indoor dining and indoor usage. And those particular models went on to further say that by putting in that level of restriction, that would decrease hospital utilization by somewhere between 20 to 30%.
Thank you. I appreciate that. I'm glad that you also pointed out that very important reality, which is that this is not just about hospitals not being able to treat COVID-19 patients, but that the fact is, and we have seen this already happen, that when you break the system, it means that there will be a lot of other possible deaths related to the fact that they were not able to receive the kind of care that we are looking for. And so that is a real concern. And other jurisdictions are seeing that happen. So I think this is why it is so important for us to act now. And as I said earlier, all of our hopes is that because of the vaccine that we yesterday saw all over the news has begun to be distributed, that there is light at the end of the tunnel, that we will not have to hopefully continue to deal with this type of pessimistic scenarios, but it does mean that we have to make some decisions right now as well. So thank you. I appreciate your answer.
Thank you. Let me, before I call on the rest of my colleagues, close the public hearing for the record, and let me accept and motion to approve the resolution.
Second.
Sorry, who was the?
Nancy moved it.
Thank you. Councilmember Navarro moves and Councilmember Rice seconds. Terrific, thank you. Back to discussion, Council Vice President Albornoz.
Thank you very much, Mr. President. This is once again a very sobering day on this dais. I appreciate and respect the very thoughtful correspondence and phone calls and conversations I've had as we have throughout the pandemic, but in particular over the last 5 days when the county executive announced his intent to move this executive order forward. And I once again want to thank Dr. Gales, Dr. Stoddard, our entire public health team, our entire emergency management team, everybody in HHS, and all of our partner providers and hospitals that are continuing to work day and night to address this most recent surge, which is profound and significant. I have a close friend whose father passed away on Saturday at a local hospital here in Montgomery County. And for 10 days while his dad was in the hospital, he was unable to visit in person, was FaceTiming with him, but couldn't actually be there to give him a hug, to be able to be them in his greatest hour of need. And he ended up having to identify his dad's body after he passed away on Saturday via Zoom. He's contacted funeral homes, and they're all so backed up right now that they're not entirely sure when they'll be able to process his father's body. We heard from Dr. Gales and Dr. Stoddard regarding the surge that we are seeing in our hospitals, which is real and raw. And if we continue on this trajectory by the end of January, if not before, we will have reached capacity within a very delicate public health infrastructure and system. And if that happens, it will compromise the care of every single one of us, whether we have an emergency, whether we are pregnant or have a friend who's pregnant. It has a devastating and compounding effect that will crater our entire public health infrastructure. We are seeing this in other jurisdictions across the country. And so it's critically important that we take steps now to lower those numbers within the context of this current surge, because what transpired over Thanksgiving has come to fruition. The concerns that people had raised have come to fruition. And so I have so much respect and really appreciate, again, the thoughtful correspondence we received. I want to focus on several categories. The first is youth sports. My kids participated in youth sports in the fall, and I saw firsthand the incredible benefit that those sports provided to them, the outlet that it provided to them, which was important. And I do give a lot of credit to all of our sports leagues for taking important and necessary steps to keep kids and families safe through the pandemic. I think they have done an excellent job on a number of different levels. I also want to acknowledge people in our restaurant industry who have bent over backwards in order to keep their restaurants safe and have taken steps in order to enact the policies that the council has moved forward and our public health officials have moved forward. And I also acknowledge the devastating economic impact that this has had on so many of our residents. We are all exhausted through all of this. We all would love to be able to see our loved ones and have life go back to the way it was before all of this started. But the current surge we are experiencing right now, if dramatic steps are not taken to address it, will have a catastrophic impact across the board. And we have to stay steadfast in order to be able to move this forward. And my hope is that once these policies are enacted, that obviously we lower these numbers as quickly as possible so that kids can go back to school, so that we can open more businesses, so that we can get back to the life that we all want to be able to get back to. But unless these dramatic steps are taken now, then not only is the situation going to get worse, but the looming vaccination, which is great news and on the horizon, will be watered down in its impact if the community spread remains where it is and gets worse. So I hate having to pass this executive order and support it. All of us do, but we must remain vigilant. And I appreciate the flexibility that our public health officials and emergency management team have shown in the past, and their flexibility in bringing hockey down from a high to a medium risk, and other steps that have been taken in certain instances as more information has become available. But the information that we have right now is clear. We have to take dramatic steps at the moment. So with that, I yield back to you, Mr. President, and I hope that we don't have to be back here soon to announce even further restrictions, and that these take and they work, and that we can come back under much better circumstances. Thank you.
Thank you. Councilmember Rice.
Thank you very much, Mr. President. You know, it's very interesting in terms of how we hear testimony about folks telling us how things are, and then we have our own information that gives us a very different picture. And so I just want to share some of that for the folks who may be watching at home. Many of you know that I serve on our National Association of Counties Human Services and Education Committee. And so there we deal directly with health and human services across the nation. And I have good friends across the country, namely some in Omaha, Nebraska and Douglas County, who told me that their contact tracers are directly tying cases and case increases, significant increases, to big box and retailers. So we're seeing it. And so to assume that that can't happen here, that those kinds of things can happen, and that's just one instance. There are plenty of them all across the board. And I too want to share my experience because I think it's incredibly important. I was at Costco less than a week ago. And when I was in my local Costco, I did not see any of the procedures and things that they said that they were adhering to. And feel free to reach out. Your district council member would love to hear differently, but my mother was just there today and she saw a completely different scenario with a line out front, with folks counting the number of people I haven't seen a line out in Costco since I were at the height of the pandemic back towards the spring, the late spring, early summer. That's the truth. And there are retailers, unfortunately, who are getting caught up in this, who are doing it well. Whole Foods in the Kentlands has consistently always had a line out front and consistently been counting. ShopRite in Silver Spring has always been consistently counting. There are a number of folks that are doing it well. But unfortunately, there are those who aren't also. And so I just want to be very clear that that's one of the things that drives what it is that we have to do. Unfortunately, in government, it's not always about the folks who may be stepping up and doing the right thing. It's about making sure that for those who unfortunately aren't doing it right, that we try and get a handle on this because we understand what great an impact it has. I'm not picking on Costco. I'm not picking on Wegmans. I'm not picking on all of these stores. I'm just stating what I've seen because I've been to your stores. I've seen it. My family's seen it. Folks in the community have seen it, and they've reached out and told us as elected officials about what's going on. There was just very quickly, there was a gentleman who always would tell me about a car wash who consistently violated the conditions. And Dr. Stoddard knows exactly what I'm talking about because he got multiple emails and phone calls from me about this particular entity. One of the things I want to caution us about when we're looking at doing waivers is that these waivers are only as good as the folks who are adhering to those conditions. And so, I want us to be careful because we saw when we tried to do waivers, when it came to some of our restaurants and the nightlife, that we saw multiple violators and multiple violations, and then had to pull back in terms of what it was that we were trying to do because folks just weren't adhering and we weren't getting the results that we need to. Community spread is community spread. There is no line or definitive, corral that keeps it in. If you're in the community and you happen to be participating in sports and then happen to go to a store or whatever the case may be, all of those things are contributing to community spread. And one of the last things that I want to close with is that for the gentleman who said that there's no need for testing, that's just not true. Please, let's not tell our community that there's no need for testing. It is very clear, and all of our health experts have been very clear in saying that we still need to get tested. Even with the vaccination that is upon us, we need to continue to get tested, especially in our communities of color, for those who are of lower socioeconomic status, who are affected by this at much higher rates. Please understand, get tested if you think you've been exposed, if you think that there's a possibility of you having COVID, if you've been to a place where you think you may have contracted COVID. Let's make sure that you focus on ensuring that you know your own health. So again, I agree with what my colleagues have said to this point. This is difficult. This is tough. This is not easy. This is not something we take pleasure in doing because we know that there are other things that we're going to have to do as a result of this. But we know that in the best interests of health and safety of our overall community, this is something, unfortunately, we have to do. Thank you, Mr. President.
Thank you. Councilmember Reamer.
Thank you. Wanted to ask Dr. Gales and Dr. Stoddard if they could share a little bit more information about the timing or the projected hospitalization use and how quickly are we approaching capacity? We didn't lose Dr. Stoddard and Dr. Gales, did we? Nope. Okay.
I'm here. I'm not on camera, but I hope you can hear me.
I can't. Oh, just make sure I get my. Thank you. Just to put a point on it, I've seen that some jurisdictions, as I know you're well aware, California, for example, New York, they are pinning, their most significant restrictions to the hospitalization utilization. Could you please talk to us about where we are in our capacity, and if the current trend continues, at what point in the coming future will we exceed our capacity and so forth?
Sure. Well, I can give you a brief estimate based upon, I'm pulling up the daily surveillance report that looks at our hospital spaces. So as of noon today, 3 of our hospitals had no vacancies. 3 out of the 6 hospitals had no vacancies within their ICU units. And 1 of the hospitals reported having no vacancies in acute care beds. It looks like we are, at this time, we have 186 beds occupied with 118 available in terms of acute beds available. And when we look at, based upon the data as of noon today, when we look at the ICU beds occupied by patients, I'm sorry. And so the vacancy numbers are overall numbers, and these are just specifically the beds occupied by patients with COVID-19 as of 12 today. 78 of our ICU beds are occupied by COVID-19 patients, leaving only 5 available staffed beds in ICU settings. And currently we have 186 beds utilized by COVID-19 patients in acute care settings, leaving 118 available staffed beds across the different hospitals. And so as we currently stand, as I mentioned, 3 of the 6 hospitals have no vacancies within their ICU. Earlier this week and over the weekend, there was a time where 5 out of the 6 hospitals did not have any vacancies within their intensive care units.
So California, oh, please, Dr. Stoddard.
Yeah, I was going to say one piece on this. So I was just looking at the graph of the data that Johns Hopkins provided in their modeling. There's been a lot of discussion about statewide beds. We're approximately 8,000 beds across the state of Maryland right now. Johns Hopkins has their projection modeling have us crossing 8,000 beds at approximately January 15th. So we would max out statewide beds, and we would not peak on beds until sometime around the first week of February, based on their current modeling, and that would put us in the area of a little over 9,000 beds as a state, which we don't have 9,000 beds. Okay, so that's the modeling if we make no interventions at all based on their current projections.
When you say interventions, you mean regulations that might reduce the spread rather than adding beds? Like, is it
correct? Mitigation efforts to reduce the transmission rate of COVID-19.
So have we done everything that we can do to add beds and so forth, or is that something we also need to?
So the state is continuing with their efforts to increase our bed count to 10,000. But I think candidly, we have to be very clear that beds 8,000 through 10,000 aren't equal to beds 1 through 8,000, and frankly, may put beds 1 through 8,000 at a lower quality of health care than you would have received had we not increased the capacity. And so you can only squeeze that lemon so hard before you stop getting any juice.
Okay, so we are on our present path. We will no longer have beds statewide. If you could please let us know how that, how that result happens at the county level as a follow-up. But in mid-January, and then continue into February. And so at that point, if a person gets into a car crash or has a stroke or has a heart attack, there is a very serious problem with their ability to get care at a hospital. Is that accurate?
Well, I think the key is you get to a situation where we see other parts of the country who are experiencing this right now. Whether you're talking about El Paso, Texas, or Missouri, or, God forbid, I think the worst example is North Dakota, unfortunately, is where you run out of space and you have to make decisions. So very similar how we're making decisions right now on actions to take to keep our residents safe, healthcare providers will have to make decisions in terms of how care is distributed and how those services are provided. And we, to Dr. Stoddard's point, is yes, it's important to continue to look at ways to increase our capacity to provide hospital care for COVID or other things. But we also think it's very important for us to, when we have tools in our toolbox that we know have been proven to be effective, it's also incumbent upon us to levy those types of things as well to keep people from getting in the hospital in general.
Absolutely. Understood. I guess what I'm really trying to get at is, I think that the next Tell us, what is the next level of regulation? Is it stay at home or is there another intervention?
Yes, that would be accurate. I think we have put in as many focused and targeted restrictions as we can. And the next level beyond this would be a stay-at-home lockdown type approach, similar to where we were in the spring.
So if the ordinances we're passing today are able to put the brakes on the transmission rate, we have a hope of avoiding the complete capacity. But if they don't, then there's nothing left but stay-at-home order. And we should hopefully see within the next 2 to 3 weeks whether this measure is slowing down transmission. What timeline do you think we would be able to see some result from this if it does have an effect?
Well, historically, typically any intervention in a pandemic or epidemic setting, you have some lead time of approximately 2 weeks. So you'd want to have it in place for 2 weeks to begin to get to see if there is an impact in terms of turning things around. And so not only do you want to see things turning around, you ideally would like to see them sustained, so that you wouldn't just say, hey, we've had 14 days and we've got a great number that's dropped. Let's go back to where we were. You'd actually want to see it sustained for some time period. So the reality is, as one of the persons who testified mentioned, is that there are some jurisdictions who have put in some time frames around that in terms of revisiting this in January. So we're looking at at least a 2 to 3 week period to see a demonstrated level of change in the numbers. And as Councilmember Navarro mentioned earlier, with the advent of the vaccine, and hopefully as we get more information about that and are able to roll that out and get that through the first couple of phases of folks and then to the general public, we're looking at a shorter window overall, not only just in terms of restrictions, but hopefully being able to move through this sometime in mid to late winter, early spring.
Okay.
If I may add, just as a good anecdote, on November 15th, the state of Michigan implemented similar measures to what we're talking about today. It took them approximately 16 or 17 days to peak out and start that downward trend. Over the last 14 days, they're minus 24%. And really, they're just now starting to see the hospital data start to dip down. So they're like minus 5% over the last 7 days. And so they're probably now starting to see their hospitalizations cap out and then start heading downwards.
From measures similar to these.
Correct.
Okay.
It's nearly a month since they implemented their changes. They see the cases go down after about 2 to 3 weeks. Hospitalizations tend to take a lot longer because typically COVID-related hospitalizations are lengthy stays. And so that, once you get into the hospital for COVID-19, your average length of stay is not just a week. Typically, it may be several weeks. So
this could have an effect. That's good to hear that Michigan had got results with their measures. Okay.
Yeah, there's a really, really great study that was done by the chair of, not a great, really in-depth study, but sort of a comparison that was done by the chair of Brown University's Division of Public Health. And it compared the state of Ohio and the state of Michigan, which have very similar populations in terms of their demographics. One state implemented measures, one state did not, and you can look at their curves and see exactly how they proceeded. Long story short, Michigan's doing a lot better than Ohio is today.
Thank you.
Councilmember Jawanda.
Thank you, Mr. President. Thank you, Dr. Gales and Mr. Stoddard. And I see some of our folks who testified are still with us. A couple things. I'll sound like a broken record. I'll say it again. I know the governor is going to speak later this afternoon. You mentioned, Dr. Stoddard, as a perfect segue, the action that the state of Michigan took, to put in these measures so that they can see a curve down. And I have continued to say, and we'll say it again, here we are, just under 2 weeks before Christmas. We're experiencing the Thanksgiving bump. It would be better for everybody involved, including the businesses and the residents and the employees that we're talking about right now, to have a temporary stay-at-home order, at least through the holidays, and then back into something like this that you're discussing that we're going to take, and I'm going to support statewide, where you can go slowly and get this under control. And then couple that with support for businesses. I'm glad there was some additional money, but we need to release everything we have here for us, particularly for our small businesses. So I just want to reiterate that, and I appreciate you bringing up the Michigan example. I hope the governor will take heed. That bed capacity issue that's a scary number, and we don't want to get anywhere close to those types of decisions that have just been discussed. The other thing I'll say is, I'm glad that we're hearing from businesses, but we talk about this on this council, and we have a commitment to equity. Our small businesses have been struggling to meet these types of restrictions and public safety measures, and in a very, very difficult time having to do that. And I would agree with some of these big box stores, some of who've testified today. There has not been uniform adherence. Some have done a great job, others have not. The other thing I'll mention is that, I think it goes without being said here. I was reading something the other day that the profits for these big box stores are through the roof, almost up 40% this year. $17 billion. And some who spoke here today are companies that are on that list. And right now at Costco, they're not getting hazard pay. They haven't been getting it since May. And so you talk about people standing outside and you're letting people in, the workers there. And when they did get it, it was $1 extra in the face of $17 billion profit. So I have a hard time hearing complaints from folks about that while our small businesses are struggling to pay rent and keep payroll on. And so I actually am not in favor. I'm going to vote for it because it's before us. But I would ask Dr. Gales and Dr. Stoddard of the waiver. I think, and the other thing is that companies like Costco and others, and you can order online and have things delivered. Some of the small businesses, those aren't options. And so there's a lot of other ways for them to conduct their business and to prevent people from actually being in the store. Many people who do have to go to the store. But I just think we need to be very careful with the waiver process and take it really seriously and make sure that there's compliance at these big box stores going forward. So my one question would be for Dr. Gales, the criteria enumerated for the waiver process. Could you just talk a little bit about that? I am sensitive to that. You want to make sure that if they're open, you account for at least their workers and anyone that's coming in the building. But could you just talk about how you're going to evaluate that waiver process and some of the considerations?
Sure. I'll actually pivot to my good colleague, Dr. Stoddard, on that because he's been working on that language.
Sure. So a few things. Number one, this letter of approval process will not be a rubber stamp. Just to be, so we're totally candid here. We agree with the assessment that you've stated, which is that some big box stores are doing a very good job. And for those big box stores that are doing a very good job, they will submit the current plans as they're operating, and we will likely
nothing will change.
Nothing will change. We will largely just rubber stamp and approve those. But where we have seen issues, both in terms of our personal experiences or in terms of our education and enforcement efforts, we'll be much more scrutinous and looking to parallel one for one those places that we know are working with those places that we have concerns about, and say, does their plan hold up to action? And then on the back end, as we talked about, and Dr. Gales alluded to this as well, it's all about not just what you put on paper, but what you actually implement. And so one of the collateral impacts of us, with the consideration you have today to close indoor dining, is we will be able to redirect significant enforcement and education staff into retail establishments where we are, where we have these concerns. So once these letters of approval, once we get in writing what their plans are, we will be able to hold them to the letter of what their plan and their approval specifically is. And so, and to be also clear, in the letter of approval process, we will be reviewing their protocols and their specific space and authorizing based on that letter of approval for a specific scenario, meaning, I think we've heard allusions to, we have occupancy up to 500. Well, depending on how the building is set up, we don't have uniform disbursement of one person in every 200 square block in a store. If there are bottlenecks that prevent you from, experiencing that full capacity, we're going to approve, the letter of approval is going to say you're approved up to X, Y, and Z based on what you've submitted and what the layout of your actual store is. And so there will be some individual scenarios where some facilities, based on what they submit, may only be approved up to a certain level of capacity based on what the team reviews that and what we find in terms not just of what the measures they can implement, but what their physical space will actually
Right. I appreciate that, realizing that there's congregation by the toilet paper or the, or the water, or, areas like that. And that's important as well. Well, I appreciate the work. I'm glad to hear that it's not going to be a rubber stamp. Sensitive to the sports issues, Councilmember Albanaz, I think, articulated those well. These are tough decisions, but we have to make them for public safety. So thank you, Mr. President.
Thank you, council member. In regards to the governor's latest aid package, I don't believe there was new aid to business. I thought it was merely loan forgiveness for the lucky few that got in the door in the first place. So thank you, council member Friedson.
Thank you, Council President, and thank you to colleagues. A lot of my questions have been asked. I'll just try to ask the ones that haven't been raised. This is an agonizing situation for us, decision for us. It is not even remotely close to the agonizing decisions that are being faced by families and by businesses, by employers and employees. And so I just wanted to note that we're not in an easy position, and yet we are in a drastically easier position to make a tough choice than they are, whether or not they have to lay off employees, whether or not they have to make tough choices, decisions that families are having to make of how to put food on the table and how to address mental health issues and the challenges with schooling right now. We've spoken a lot about the healthcare related issues, so I won't belabor those points, although I think that they're critically important. And I will note, I thought Dr. Peter Hill earlier this week from Johns Hopkins put it really well related to the vaccine and where we are, that there is light at the end of the tunnel, but the tunnel is 4 to 6 months or more long, and we have to avoid the tunnel collapsing before we get to the other end of it. And that's the situation that we're in. I think that is a good metaphor. There is a positive here that we have a vaccine that's coming, 155,000 doses or so coming, but we've got quite a ways to go, and our numbers are in a really tough situation. Separate from the healthcare issue, the other huge issue is school. And I just, if Dr. Gales and Dr. Stoddard, you could quickly just mention how this relates to, where we currently are with our numbers and what this would mean or could mean in terms of the possibility of starting the phasing, which begins with the most vulnerable populations for MCPS, to get back on or get as close to on track of mid-January as has been discussed. I think they mentioned today that 15 cases per 100,000 is what they're currently now looking at. But if you could just state where we are, where you think we're headed, and what relationship this has to school, as you earlier had with the healthcare capacity challenges.
Sure, I'd be happy to take first crack. And thank you for the question, Councilmember Friedson. So they actually did, from my understanding, vote, and they will be revisiting the school reopening in February as a potential date. They'll look at where we stand in early January. But the metrics that have been put forward for the schools are guided by what the state put out in terms of their measures of test positivity and cases per 100,000. They set metrics of 5% for test positivity and 15 cases per 100,000 at the upper end of hybrid in-person learning. And that is the model that's consistent with the guidance that we provided from a public health perspective. And similarly, the CDC guidance, I know lots of folks have said that the CDC changed their guidance. They didn't actually change it. Dr. Redfield did make comments to say that they would, we all want children back in school, but there is no consensus in terms of having kids back in school at higher levels of community transmission where we stand right now. And all of the quotes, including Dr. Fauci, whom lots of folks like to quote, has said, yes, our preference would be for kids to be in school, but in order to do it safely, it must be done in the environment of lower community transmission. So with all that in mind, where the schools currently stand is they have prioritized bringing back children who fit into special populations, as well as early kids in the process, so elementary school kids. And the models that they have and the algorithm and matrix that they put forward is consistent with that, bringing those students back earlier and making sure they are entrenched in in-person learning or, hybrid learning, however the numbers dictate that, and then moving forward with the older students. It's important to also clarify, and I know I'm taking some liberties with the question that you asked, but we get this question a lot, and I want to, clarify this for folks in the public. Is lots of folks have said, well, school district X is open at this time. Why aren't we open? Well, again, there's no consensus on that. So New York, as we've talked about before, did have a higher level of restrictions in terms of the test positivity that they put forward and having kids come back. It was set at 3%. The mayor changed over the weekend last weekend, and decided that they were going to keep the kids in school. And even at that point, the test positivity was approximately 4%. When you compare that to where we are this morning, our test positivity was 6.3%, and our cases per 100,000 are approximately 44. So it's a very different picture in terms of real-time data, in terms of comparing the surveillance data with us in New York City and New York State. And similarly, when you look at large jurisdictions such as Los Angeles, they made the decision not to bring back kids until later, similar to what Chicago did, and similar to what a host of other jurisdictions, including the overwhelming majority of the jurisdictions in Maryland, as well as in the Northern Virginia and DC area. So it is a challenging piece. The numbers have moved, are set in terms of the guidance and what they put forward. Now, the question is, how do we get there? So to get to the heart of your question, what I think is the heart of your question is, how do these metrics get us there? Well, again, we put forward these levels of restrictions to drive the community numbers down, because if we get community transmission down, that gets us within that window of being below 15 cases per 100,000 and test positivity below 5. So the actions that we're taking now are going to drive the numbers down, which has the collateral benefits of kids being able to go back to school, being able to resume these different activities. Because again, as we've talked many times before, lower levels of community transmission, and particularly in the setting of having a vaccine available that is being rolled out to our most vulnerable populations early on, will create a situation where we feel more comfortable and confident that the likelihood of someone entering in those spaces, whether it's a school or gym or whatever type of business, the likelihood of them bringing COVID into that setting is incredibly small.
I appreciate that. If, Dr. Stoddard, just if you could chime in.
I think the key takeaway is the measures that the county council is considering today will substantially improve our chances of having schools be back in session along the timeline that MCPS is looking at. And what I mean by that is, we've talked about, Hopkins is projecting a 30% impact on beds. You see translation of beds when you see cases, you'll see a positivity reduction. We would not be recommending these actions if they were all for naught. We firmly believe that these kinds of recommendations will substantially drive down, and they are really, frankly, our only hope of even having a chance in February. I don't want to give a promise to say, February 1 will be good to go. We're going to do everything in our power to make it be so. And our residents and we control a lot of that. But make no mistake, the things that you all are considering today are really our best and only chance of having kids be back in school in February.
Okay, that is very helpful. I think very important. Aside from the healthcare surge and the issues with somebody having a health issue and not being able to get reasonable quality care, I don't think there's anything more important than the ability to get kids back in school. So I just wanted to make sure that was noted and raised. We're asking restaurants specifically to do contact tracing and to be involved in contact tracing. I've heard from a number of them questions about whether or not that contact tracing is happening related to the restaurants. Obviously, if we're asking folks to do something, we should be acting upon it. I know the state plays the primary role in contact tracing, and the county plays a supplemental and supportive role in contact tracing. But could you just explain? You've shared with us some of the contact tracing related to indoor dining, some of the changes since September, some of the rationale behind the concerns that you've raised both locally, statewide, and nationally. But could you just explain how we're doing that contact tracing and provide some understanding that the information that we are collecting is being used and how?
Sure. So the way the contact tracing process happens is anyone who tests positive for COVID-19 through any of the labs, there is an electronic lab reporting system where the labs report that directly to the state surveillance system. When a case pops up in the surveillance system, it is pulled by an investigator who, if is either calling you to notify you that you tested positive, or you have known, whether it's through your provider. And in that conversation, when they talk to you, they go through a series of questions to ask you to ascertain, the time window when you, if you were symptomatic, to try to get a sense of when you were most contagious or when you were first contagious, the types of venues and spaces you were in during those time periods, to assess who else may be at risk or an identified contact with you. That information is gathered and it is basically summed up in terms of input into the system. And then we get an aggregate report to say, of everyone who tested positive in Montgomery County, 40% said during the time period where we think they were, infectious, 40% said they were working outside of the home. 30% said they were in it at some point during the time period were in an indoor dining facility. 20% were at a house of worship. 10% were at a gym, so on and so forth. And the reason why there's certain activities that jump up that are more concerning is the type of setting where they are, the time periods within which individuals are likely to not have had on a face covering. So for example, when you're in an indoor situation, you're removing your mask to drink and eat. And during that time period versus others where you may not have to actually pull off your face covering during that time period.
Got it. Okay. Thanks for that clarification. I'll follow up if there are any questions of specific instances. There's also been a question now that we're prohibiting indoor dining of tents. Could you just clarify? I know this has been stated in different settings, but clarify for restaurants and for residents related to a tent, covering an outdoor patio area or creating an outdoor area, what would be allowed in terms of the number of sides that would have to be open and how it would need to work?
Yeah,
in order to be considered outdoor dining?
Yeah, the Department of Permitting Services actually does regulate, and you're required to get a permit for an outdoor tent related to dining. It's a semi-permanent fixture, and so that does have to have a permit. Essentially, the rules are that if it's a square or rectangular shaped tent, as most are, it has to be open on one of the four sides. It also, if it's any other shape, generally use the 25% of, so if it's like a yurt shaped or a something other shape like that, about 25% has to be open. But we ask that people just consult with us, if it's an unusual shape, to verify that what they're planning to do would be appropriate, and they can do that through the clarification or the letter of approval portal. There are requirements for the permitting services that are on the Department of Permitting Services website, or you can contact 311 and they can also provide that information about exactly the requirements for the permit itself, and they actually have to come out and do an inspection of the tent once it's established. And so we've been doing this process since September, and it's been moving pretty efficiently. And so as more opportunities increase, I've seen some additional ones. We will continue to permit and inspect those to make sure that they are safe.
Appreciate the clarification. I think it's helpful for folks to know and understand. We've gotten some questions from residents who aren't aware even of what the rules are and aren't. Related to youth sports, echo all of the comments that Councilmember Albornoz has made on these. This is a huge outlet, a critical outlet for young people. I understand some of the challenges. I do believe that the organizations have acted as responsibly as they possibly could, put in place as many safeguards as they possibly could, and has largely been a net positive. I just wanted to check in terms of the letter of approval or letters of approval for youth sports. is the intention to find ways in order to operate safely with specific safeguards, like how you've described the retail setting that exceeds 150 people, to ensure, you know, the congregating issues and the regulating of the number of people indoors are addressed? Or is the determination that having more than 10 people indoors in a gathering is just not safe right now, and you don't expect to move forward with the change until the numbers change? I just think it's important that that be clear and the expectations be set publicly.
Well, the expectation is more the latter than the former, is that we would recommend folks, you know, there are allowances to still do drills and those types of things, and we would recommend folks to operate within those particular parameters.
Okay, so the expectation is that that a letter of approval that would result in games being played indoors with more than 10 people is not something at this point, with the numbers where they currently are, that you would be approving.
That is correct.
Okay, thank you for the clarification. I'll just end, and I think it's important that we note each time, because there's different people who tune in and who focus on these depending on what the changes and impacts are. But the role that the council has, which continues to frustrate me, I don't believe we should be voting on these. We don't have the ability to write them. We don't have the ability to amend them. We have to vote them up or down. There's a legal question and ongoing legal questions of what would even happen if we didn't vote in favor of one of these, because an executive order still would be in effect. It just wouldn't have the concurrence of the council. I think this is a bad process. I think that it is a peculiarity of the way that the governor wrote the original executive order and the way that our government is set up that continues to frustrate me. I know it frustrates residents. I know it's incredibly confusing. It doesn't make for an easy way for residents to advocate and to understand, you know, how and in what manner decisions are being made. So I just wanted to make sure I noted that here and made sure that, you know, everybody understands what we are, what we aren't doing here, and what we are legally allowed to do and what we can't do. But appreciate the opportunity to get these clarifications. Thank you.
Thank you. Councilmember Glass.
Thank you, Mr. President. Appreciate all the questions my colleagues asked. And so most of my questions have been answered, but I've been hearing a few points that I just want to elevate and re-up in this conversation, to really reframe it and drive it home for all of our concerned residents, for all of our concerned business owners, about the course of action that the county is taking and why we are set to move forward in a matter of minutes. Dr. Gales, the dashboard online says that 76% of our ICU beds are occupied, and that 21% of hospital inpatient beds are occupied. And you shared that 3 out of the 6 hospitals here in the county have no vacancies in our intensive care units. Is that correct?
I'm pulling up the dashboard to make sure I see what you're talking about to clarify, but no, the information that I provided you is accurate. So let me just scroll through just to make sure I'm seeing what you're saying.
And I'll say that the reason I'm just re-upping this is because I'm getting communication in real time with people who are looking at the dashboards because of the comments and questions that my colleagues have been asking. And for some of the people who are communicating with me, the numbers just don't add up. And some have actually said that, 76% occupancy rate, that's what a hospital's supposed to be at. It's supposed to be taking people who are sick. And so I just want to square all of this for the general public.
So the information that I provided, we can go back and clarify, but at the 21% number that you mentioned isn't accurate. I think it's flipped. So it's actually, when looking at the marker, 78% of the ICU beds are in utilization and 78% of the acute care beds are in space. And that actually is consistent with the numbers that I've provided. in terms of having 118 beds free, as well as within the ICU setting, at least one of the 6 ICUs is at capacity and doesn't have vacancies at this time. So again, it also determines the size. There are larger ICU settings in at least 2 of the hospitals in comparison to the smaller ones. So let's say one of the smaller ones is at capacity if I've got 10 beds there versus another one which may have 30 to 35 beds available in that space.
Okay, well, I appreciate you clarifying one of the pieces of information that's on slide 7, I believe, on that data chart. And it's 70, you said more than 70% of our ICU beds are occupied with people who have COVID.
No. So, no, what I think there's some confusion here. What you referenced, and I may have misunderstood you, so forgive me, is that when looking at the dashboard right now, you're looking at the percentage of hospital beds that are covered by COVID patients only. And that's a subset of the total use of hospital beds. So again, to go back to our point before is, yes, it's important about COVID patients utilizing hospital beds, but hospital beds are used for a whole host of other things. And so the concern is that as that percentage of use goes up for COVID, that takes beds, free beds available to take care of those other resources and situations. So God forbid we do get to a situation where 78% of our beds are COVID patients. We don't want to be there. And so I misunderstood the parameter within which you're talking. So yeah, so what we're looking at right now is 76% of our ICU beds are in use overall. And this is updated yesterday, but the percentage of inpatient beds taken by COVID-19 patients is at 21%, but that has increased significantly over the last month. And back in the spring, we saw a high of 38.7%. That was in our peak in March. And just as point of reference, on October 24th, the percentage of COVID patients was 5.7%, and it's almost quadrupled in the span of 6 weeks.
Well, thank you for walking us through those numbers, because as you just said, God forbid anybody needs to go to a hospital. We want to make sure that the facility is available to them. And those are the precautionary measures that we're taking. And as you have said on various occasions, the hospitalization data are lagging indicators because the spread is happening out in the community right now. And by the time it reaches a level, God forbid, that anybody needs to be hospitalized, that data will come in days or weeks from now. And so again, just really important to share with everybody who rightfully so is concerned and anxious for a host of reasons about their own health of their family, health of their business. We want to make sure that everybody is healthy, and that we're all here when the vaccine is safely administered to all of us. And so again, thank you for everything that you're doing, and the actions that we're going to be taking today are to ensure the health and safety of all the residents here in Montgomery County. So thank you very much.
Thank you, Councilmember Katz.
Thank you very much. I will try my very best to be fast. All of my colleagues have certainly asked and said so much, and I'm in agreement with so much of what they've said. But I do want to once again thank Dr. Gales and Dr. Stoddard, and I want to thank the public and all who have testified and sent in emails. This is the most difficult situation that any of us, whether you're in public office or not, that we have to deal with. This is a horrible situation, and each one of us is living it in a very different way. And those who have lost loved ones, I mean, just last week, 2 weeks ago, where my good friend, who I knew since I was 12 years old, Jerry Samet, they passed away from COVID. I mean, it has hit every one of us, every one of our families, every one of us is being directly affected by this horrible situation. And of course, no one wants our economy to have happen to it what is happening. And that's whether it's restaurant or retail or any other industry. We are not in a good situation. But that's not what we want to do. It is in some ways what we almost have to do. And I know that there are people that say, look, we're trying our best, and I don't care what industry, whether it's restaurants or whatever, that they're trying their best to be safe, and they are. But this is something that goes beyond just what's inside your doors. This goes beyond people that walk in as well. I do want to thank Dr. Gales and Dr. Stoddard for working, and I understand that there are people that don't want the big box stores to get waivers. I understand that I'm a small businessman by trade, by heart, and I understand that small businesses need relief, and we need to find how we can help them economically as well. But the waivers are necessary if it is fair. And in some cases, the big box stores help the small businesses. They are the supplier for the small businesses, whether it be the Home Depots or whatever. They supply the contractors. So I think this is not something that I'm very happy to vote for, but I am going to vote for it. And I am hoping that we can come back as quickly as we can to reverse this so that we can start to see the trends come down, and that once the vaccine does take effect, that all of us will see that we have done the right thing so that we can get back to as normal. We're never going to be normal for many, many months, but that we can get back to as normal as possible. So I am going to vote for it, but I'm certainly not a person that is pleased that I have to vote for it. And so with that, I thank you very much, Council President.
Thank you. Councilmember Reamer.
Thank you. This has been a really helpful conversation, and I wanted to thank everybody. I think we clarified a lot of really weighty issues, at least personally for me, about potential outcomes over and what we might hope to happen in the coming weeks. I am really pleased to learn of the framework that the BOE has adopted today. I think that's really getting it right. Moving to February 1st, a more realistic date, and then coming up with a framework that prioritizes younger children that research shows are far less likely to transmit the virus. So, compliments to the board. And now we just need to drive these numbers down. And the CDC's guidance, which I know I'd mentioned previously, that schools should be the last to close and the first to reopen. Let's hope that this works, and let's indeed hope we don't need a stay-at-home order. If we do, we do. But let's hope that this works and this gets us where we want to go. And and then, as has been said, among the very first things that we could reopen would be schools for younger children. Thank you. Really appreciate the dialogue today.
Thank you, Councilmember Friedson.
Yeah, just really quickly, I just wanted to make sure I clarify because I think it was a little bit confusing. This order is not providing special treatment or an added benefit to big box retailer. In fact, it's doing the opposite. It is providing an additional safeguard of 150 person cap because large congregations of people are an added risk that are in many ways unique to larger facilities under the 1 per 200 square foot standard. What the understanding was that Dr. Stoddard, Dr. Gales, and the public health team realized was because some of the larger stores are so big, 150,000 square feet or larger, just the staff to open the store would get them to the 150 person limit or close to it and would have shut them down. And that was not the intention. The intention was to put in place more stringent restrictions in order to ensure safety and to avoid congregating and all of the other public health. And so the decision was a letter of approval, which I think appropriately places the burden on the businesses to prove how they are going to keep residents and employees safe while they continue to operate and abide by the 1 per 200 square foot standards if they're going to exceed the 150 people. So it's an added restriction on larger stores, not a reduced restriction on larger stores. And I think given the large crowd issue and the congregating issues, it's an appropriate concern that the executive branch has done. And I personally, appreciate the fact that I think the executive branch has tried to find that appropriate balance between, putting the burden on the businesses to prove how they can operate safely for their employees and their and our residents. So I just wanted to note that I think there was a little bit of confusion in the discussion. I think that distinction is very important. We're putting on an added restriction for larger businesses, not a lesser restriction for larger businesses, and requiring them to have the burden of proof to ensure how we can keep our residents, their employees, and customers safe. The last thing I just wanted to say, I neglected to mention in my comments that Councilmember Navarro mentioned and others, we have done a lot to try to support our local businesses, understanding that it is an existential threat to families and to our local economies and our families' livelihoods. It's nowhere near enough. We need to do more. We have to do more at the local level, but we need a lot of help. We don't have the funding or resources right now to be able to continue that with CARES Act funding running out. And so I neglected to echo the comments that the Council President, Councilmember Navarro, and others have made, that we need to do more, but we need support from the state and the governor, and we need support from the federal government and our federal partners to provide us with those resources, because we recognize that the decisions that we're making, while they're important for public health, are going to have a devastating impact on whether or not businesses can operate and whether or not families can survive. So thank you, Mr. President.
Thank you. Councilmember Navarro.
Thank you, Mr. President. Very, very, I think, important conversation. I wanted to clarify that, of course, the question I asked regarding our hospital capacity and our ICU beds very much tied to the fact that early in the year, one of the special appropriations that we adopted was to provide support for capacity for our hospitals. And I know that there's been a lot of work, Dr. Gilson Stoddard, to make sure that there are conversations with other hospitals in the region, et cetera, and in the state, just to make sure that we're monitoring this. But this is not the only metric that we're taking into consideration, obviously. But the fact is that the cases that we have, the confirmed cases per 100,000 residents, are at an all-time high. And so I think that is important, because for some reason, things, sometimes people get to they focus on just one piece of the conversation. It's a combination of those factors. And again, the earlier that we're able to mitigate this impact, the earlier then our students will be able to go back to school. I mean, we've had that conversation as well. When people talk about what happened in New York City, et cetera, we're always trying to figure out what is it that our jurisdictions did and what is it that we need to do. We've talked about the fact that it's not just a statewide issue, but also a regional issue. And it's hard to mitigate all of this if we don't have consistency throughout. So we're trying to do the best possible with our particular jurisdiction, but there is no doubt that we're looking at this from a holistic perspective of all of these different metrics. And we also know, and we've said this before, that the winter was going to, pose a very particular challenge to us, given also the flu season, given that we're going to be indoors more, et cetera. So I just wanted to clarify that. As Councilmember Glass said, there's been in real time questions about just that one metric about hospital capacity. And the other issue I will say is that we don't want to get into, to a point where we have, a very pessimistic or just high risk on our dashboard regarding the capacity for hospitals. Where, if we get to that point, then we haven't really done our job. What we're trying to do here is to mitigate and avoid getting to that particular point. So anyhow, again, it's already been said, this is just not an easy thing to do. It's not a pleasant thing to do, but it must be done. And I think, again, for our students, our teachers, parents, yes, I think the earlier and the faster that we act on these issues, hopefully then the sooner that our students will be able to get back to school, which is absolutely the thing that we want most for a whole entire host of reasons. Thank you.
Thank you. I think that's it from my colleagues. So, so many of you have spoken so eloquently about this. But as Councilmember Joanna reminded us, the governor's speaking again at 4 p.m. So let's all fervently hope that he's calling this news conference to announce that our small businesses and our workers will finally get the support they deserve from the state. They've been so much of the collateral damage of this crisis through no fault of their own, and they badly deserve this appropriate support, especially now that it's clear that it looks like we're not going to get the appropriate level of support from Congress that we need. There's just no point in the state waiting any longer to provide the support that our small businesses and workers deserve. We have a motion on the table to approve the resolution from Councilmember Navarro and a second from Councilmember Rice. Will the clerk please call the roll?
Mr. Glass.
Yes.
Mr. Glass votes yes. Mr. Duando.
Yes.
Mr. Duando votes yes. Mr. Reamer.
Yes.
Mr. Reamer votes yes. Ms. Navarro.
Yes.
Mr. Navarro votes yes. Mr. Rice.
Yes.
Mr. Rice votes yes. Mr. Friedson.
Yes.
Mr. Friedson votes yes. Mr. Katz.
Yes.
Mr. Katz votes yes. Mr. Albornoz.
Yes.
Mr. Albornoz votes yes. Mr. Hucker.
Yes.
Mr. Hucker votes yes.
So the motion passes unanimously. Thank you, colleagues. Now we can move to the consent calendar.
Mr. President, you have two resolutions.
I beg your pardon.
You have the sitting as the council, sitting as the Board of Health. You have the second resolution adopting Executive Order 139-20 AM2 as a Board of Health regulation.
Beg your pardon. I was foiled by the page break. I need a motion for the second resolution, please.
So moved.
Council Vice President Albornoz moves, and a second. Councilmember Rice seconds.
Second.
Thank you. The clerk can call the roll, please.
Mr. Glass.
Yes.
Mr. Glass votes yes. Mr. Drumondo.
Yes.
Mr. Drumondo votes yes. Mr. Reamer.
Yes.
Mr. Reamer votes yes. Ms. Navarro.
Yes.
Ms. Navarro votes yes. Mr. Rice.
Yes.
Mr. Rice votes yes. Mr. Friedson.
Yes.
Mr. Friedson votes yes. Mr. Katz.
Yes.
Mr. Katz votes yes. Mr. Albornoz.
Yes.
Mr. Albornoz votes yes. Mr. Hucker.
Yes.
Mr. Hucker votes yes.
Motion passes. Thank you, colleagues. Now, thank you, Mr. Drummer. Now we can move to the consent calendar. I need a motion to approve the consent calendar, please.
So moved.
Council Vice President moves the consent calendar.
Second.
Councilmember Reamer seconds. All those in favor of the consent calendar?
Any discussion?
Any discussion? Councilmember Reamer, please go ahead.
That was a joke. Sorry.
It's an inside joke. Okay. If there is no discussion, all those in favor of the consent calendar, please raise your hand. That is unanimous. Wonderful. If there is no other business, Madam Clerk, I believe we can adjourn.
Yes.
Okay. We will see you all, I'm sure, sometime soon. In the meantime, for all those who don't see us, have a wonderful and a very safe holiday.